Welcome all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about corticosteroids. Okay. So before entering, we have to know about the divisions of corticoids. The adrenal cortex. That means adrenal cortex will be divided into three zones. First one is zona glomerulosa, zona fasciculata, zona reticularis. They will secrete different corticosteroids. Okay. So those are zona glomerulosa will helpful in secretion of medulloccorticoids and aldosterone. Zona fasciculata will be produce glucocorticoids. Zona reticularis will helpful in production of androgens. Okay. In this among these medulloccorticoids and aldosterone will be under renin control mechanism. Okay. This glucocorticoid and androgens which are under cortisol mechanism. Okay. So the both are under cortisol and this medulloccorticoid and aldosterone will be under renin mechanism. Okay. So first of all, we will see glucocorticoid actions. What are the therapeutic uses and their actions? Okay. So their actions obviously glucocorticoids will acting on carbohydrate mechanism and they will raise hyperglycemia. One thing. Second one is enhanced gluconeogenesis. Okay. So if you see here, all both things will be they will elevate the glucose level in the body. Okay. That means glucocorticoids they will have hyperglycemia condition. Next one is they inhibit protein synthesis. Okay, that is on protein. They will inhibit protein synthesis and lipids. They will enhance lipolytic effect. That means they will break down the lipids and they will mobilize free fatty acids in from central to the periphery. That means centripetal obesity means they mobilize free fatty acids and increase mobilization of fatty acids all over the body. That means they will deposit in the different parts of the body, leads to cause centripetal obesity. In the centripetal obesity, patient will have features like buffalo hump, moon face, cutaneous striae. These three are clinical features for the Cushing syndrome. Okay, so you have to remember the based on the feature they will give the picture and they can ask what is this condition. Okay, so you have to remember. Okay, so next is what are the other actions of glucocorticoid other than carbohydrate, protein and fat? They will have anti-inflammatory effect also. That means they inhibit pro-inflammatory and acute inflammatory mediators, and on CVS they will have cause symptoms like hypertension, increased cardiac output. Next, an hematopoietic system, they will increase number of RBC, platelets, neutrophils and decrease lymphocytes, eosinophils and basophils. These are the effect on hematopoietic system. In CNS, obviously they will cause mild euphoria and high dose of seizures. And if you are giving in high dose, obviously they will induce seizures. Okay. These are the actions of glucocorticoids. Okay. Next will be therapeutic uses of these corticosteroids. Okay. So mainly they were using in replacement therapy. When the patient will have deficiency like addition disease, we will use in a replacement therapy. Next, obviously they will have anti-inflammatory because they will inhibit pro-inflammatory and inflammatory mediators. Next, immunosuppressive therapy and bronchial asthma because of steroids, they will have medulloccorticoid activity. So they will use as a anti-inflammatory in bronchial asthma also. Next, severe allergic conditions. Next, stimulation of lung maturations like beta-methasone and drugs, dexamethasone drugs will be useful in lung maturation in premature babies. Okay, premature infant they don't have lung maturation, so we'll give these drugs to enhance the lung surfactant. Okay, next will be in malignancies like Hodgkin lymphoma. Okay, Hodgkin's lymphoma condition also will use these drugs. Next will be hypercalcemia of sarcoidosis and vitamin D intoxication also will use. Next, myasthenia gravis, infective diseases like pneumonia, shock, and we use one thing is that is diagnosis purpose of Cushing syndrome. Okay, that is dexamethasone suppression test. This is an MCQ. Okay, so for diagnosis of Cushing syndrome, which drug will be useful? Dexamethasone. How means we will give dexamethasone in the night time. That means in the around 9, 11 p.m. around like that. Because after that giving, obviously cortisol will get suppressed. Okay, if it is suppressed, it is normal. If it is not getting suppressed, means there will be some exogenous production of cortisol will be there. So we will diagnose as a Cushing syndrome. If it is then after that also we will give based on if it is ectopic or it is adrenal base. We have to find out. Okay, that's why diagnosis of Cushing syndrome we have to use. So these drugs will be useful for the diagnosis of Cushing syndrome. The diagnosis of Cushing syndrome, which drug will be beneficial? Dexamethasone. Okay. Okay. The next will be Contraindicated conditions of glucocorticoids. Okay, what are the contraindications of corticosteroids will be obviously peptic ulcer, because these are enhanced peptic ulcer condition. Second, diabetes mellitus, because they will increase glucose level, hyperglycemia, so contraindicated diabetes. Next, CHF, obviously they will enhance more heart failure and hypertension will be caused, so obviously in both conditions the CHF will be contraindicated. Next, obviously steroids will cause loosening of calcium, so they will cause osteoporosis. TB, they will enhance more lesions, so obviously TB contraindicated. Then cataract and glaucoma, epilepsy, in this all these conditions, these corticosteroids will be contraindicated. Okay. Next. Next will be what are the drugs we'll have in glucocorticoid group. Okay, in the group we'll have short acting group, intermediate acting, long acting. Okay, in glucocorticoid, short acting will be they will act 8 to 12 hours. Drugs will be hydrocortisone. Okay, this hydrocortisone will have glucocorticoid with maximum mineralocorticoid activity. Okay, they will have more mineralocorticoid compared with glucocorticoid, but they will have both glucocorticoid and mineralocorticoid, but it will be more side and mineralocorticoid. That's why we'll use in asthma and some fluid accumulation conditions will use hydrocortisone, because it will have anti-inflammatory at the same time mineralocorticoid activity. Okay, next group will be cortisone. It will have more mineralocorticoid because they will be least potent of glucocorticoid. Next group will be intermediate group. They will act, the duration of action will be 12 to 36 hours. In this group we'll have drugs like prednisone, prednisolone, methylprednisolone, triamcinolone. Okay. Next will be long acting. There will be have acting duration of action for 3 days, like 36 hours to 72 days. Okay. In this group, drugs will have main dexamethasone. It will be having maximum glucocorticoid. Drugs with maximum glucocorticoid activity will be dexamethasone only. Okay. Beta methasone will also having maximum glucocorticoid, but it is more potent. Okay. Potency wise, if you see dexa beta will be more potent. Okay. But the maximum glucocorticoid activity will be dexamethasone. Okay. Because why I am stressing means this glucocorticoid activity you have to remember. Drugs with glucocorticoid and mineralocorticoid means hydrocortisone only. Maximum glucocorticoid activity means dexamethasone. Okay. So this is the groups. This is the drugs in glucocorticoid group. Next group will be mineralocorticoid. Okay. Mineralocorticoid obviously will have drugs like aldosterone, fluorocortisone, DOCA. Okay. In aldosterone it will be more potent and more mineralocorticoid activity. Fluorocortisone will be having mineralocorticoid with maximum glucocorticoid activity. Okay. That means if patient is having asthma and pulmonary edema condition, we will go with fluorocortisone because it will having anti-inflammatory at the same time mineralocorticoid activities. That means it will flush out the excess fluid. Okay. Next, DOCA, it will be have only mineralocorticoid activity. So you have to remember here drugs name and their activity, whether it is glucocorticoid activity or maximum mineralocorticoid activity. Which good activity will be more? We have to remember. Okay. Next. Next group will be glucocorticoid synthesis inhibitors. Okay, here glucocorticoid synthesis inhibitors, we have to remember the names of drugs is enough. Okay, they won't much stress. Meterapone is the glucocorticoid. First group will be meterapone. It will inhibit 11 beta hydroxylase enzyme. You have to remember the enzymes which they are inhibiting. That's enough. Okay, because meterapone will inhibit 11 beta hydroxylase. They convert 11 deoxy precursor to the cortisone, corticosteroid, hydrocorticosteroid, aldosterone. Okay. So the uses will be differentiate between primary, secondary adrenal insufficiency and Cushing syndrome. Okay. Here main thing is meterapone inhibit 11 beta hydroxylase enzyme. Okay. Uses will be primary and secondary adrenal insufficiency and Cushing syndrome. Next group will be aminoglutamide. Okay. This aminoglutamide will block conversion of cholesterol to the pregnenolone, and they will also inhibit aromatase enzyme. There will be inhibit estrogen production. Okay, we have to remember this thing. Aminoglutamide will be inhibit aromatase enzyme. Okay, thereby estrogen production will also get decreased. Used in Cushing syndrome and congenital adrenal hyperplasia. Okay. Next, because you have to remember the drug name and their inhibiting enzymes. Okay, here aminoglutamide will inhibit aromatase enzyme, and they will inhibit the production of cholesterol to the pregnenolone. Next is mitoten. Okay, it is a adrenocorticolytic agent. Okay, that means these drugs produce atrophy of zona fasciculata and reticularis. So obviously if tumor is not inoperable, okay, that means if you are not using by surgical method, so in those conditions we will use this mitoten because they cause atrophy of zona fasciculata and reticularis. So most commonly used in inoperable adrenal carcinoma or adrenal hyperplasia. In both conditions, that means in which condition which we are not able to surgically remove the tumor. So in those conditions, we'll use mitoten because it is an adenocorticolytic agent. It will cause atrophy of zona fasciculata and radicularis. Okay. Next important drug will be ketoconazole. It is an antifungal drug. Inhibit CYP17 alpha hydroxylase and 3 beta hydroxysteroid dehydrogenase enzyme. Okay, with both enzymes. That means 17 alpha hydroxylase and 3 beta hydroxysteroid dehydrogenase. Helpful in Cushing syndrome. Next group will be glucocorticoid antagonist. That means receptor antagonist. These drugs will be mifepristone. They have competitive antagonist for progesterone. At the same time, glucocorticoid. Already discussed in when you are discussing estrogen group, in that they will have mifepristone. Okay, that means they have high dose of blocks. Because of in high dose is blocks HP axis, that is hypothalamus pituitary axis, thereby increase endogenous ACH and cortisol level. Okay, these are also useful in inoperable adrenal carcinoma. Okay, one more drug that is mitoten. Okay, which fail to respond other treatments. So that means those are big tumors. They can't operatable by surgical method. So in those conditions, we use these drugs to cut down the size. That means they will cause atrophy of the size. After that, we will do surgical treatment. Okay. Next group will be medulla-corticoid antagonist. Medulla-corticoid antagonist will have drugs like spironolactone. This is potassium sodium diuretic. Obviously, diuretic, antihypertensive. They will use as an antihypertensive also. Then they will have side effects like gynecomastia. That's why these recent developed molecules, epinephrine, drospirenone will be there. They won't have that much of anti-androgen effect, so they won't cause that much of gynecomastia. Okay, compared to spironolactone, epinephrine, drospirenone, they doesn't cause gynecomastia. That will be we are using safely. Okay. So your main thing will be how to remember the drug name and their inhibiting enzymes. Okay, like ketoconazole, 17 alpha hydroxylase, 3 beta hydroxylase. Then glucocorticoids, obviously mifepristone will have. It is useful in inoperable carcinomas. Along with mifepristone, will you also have one more drug that is mitoten. Okay, here main thing will be you have to remember the name and enzyme inhibition. Okay, that's all. Thank you.